Hello, my dear friends. Wherever you are in the world, whether you're waking up slowly with a warm cup of coffee in Boston, enjoying an evening walk under the quiet skies of Dallas, or sitting peacefully in your backyard in Seattle listening to the soft hum of the city, I want to welcome you. I'm Dr. Michelle Zion, and today I want to share a conversation that many men, especially men over 50 and 60, have never truly had before. It's a conversation about understanding your partner's body, not just for the sake of knowledge, but as a doorway to deeper connection, more trust, and more joy in the love you share. Now, before we begin, let me ask you something. Where are you joining me from right now? Type your city or country in the comments. I love to see just how far these important conversations about intimacy and connection can travel. And as always, check the description below for wellness resources I've handpicked to support men's vitality, circulation, and confidence. Because when your body feels cared for, it's so much easier to show up fully in your relationship. So let's breathe, relax, and step into this together. Why this conversation matters. Picture this. It's Saturday night. The world outside has slowed down. No deadlines, no rushing, no long lists waiting for you. You're sitting with your partner, maybe sharing a quiet meal, maybe laughing about a memory from years ago. You lean closer, and the noise of the world fades away until it's just the two of you. Skin, breath, presence, love. And then perhaps, in one of those moments of closeness, something happens that feels unexpected. Your partner's body releases in a way you didn't anticipate. You pause, maybe even wonder, what just happened? Is this normal? Should I be concerned? Or should I be celebrating? For many men, especially those who grew up in generations where sexuality was rarely talked about openly, this can bring a wave of questions that are often left unspoken. So today, we're going to step into that space with honesty, compassion, and clarity. We're going to talk about something often whispered about, but rarely explained. Female ejaculation, sometimes called squirting. And more importantly, we're going to explore not only what it is, but what it means for intimacy, trust, and connection in your relationship. Moving beyond myths. Let's be real. A lot of men first hear about squirting through jokes among friends, scenes in adult films, or random stories that leave more confusion than clarity, and because of that, many carry silent questions. Is it real? Is it just urine? Is it healthy? Should I be doing something to make it happen? If you've ever quietly wondered about any of those, you are not alone. These are exactly the kinds of questions that come up in my practice every single week. And here's what I want you to hear first. There is nothing shameful about being curious. Curiosity, especially in intimacy, is not weakness. It's strength. It shows you're present, you're willing to learn, and you care enough to seek understanding instead of assumptions. The body's wisdom. So let's talk about what's really happening in the body. Explained simply, in a way that feels human and clear, when a woman becomes deeply aroused, her body often shows that in more than one way. The most familiar is natural lubrication. This is her body's way of saying, yes, I'm ready. I feel safe. I feel open to connection. But sometimes, with the right combination of arousal, emotional safety, and stimulation, particularly around a sensitive area inside the front vaginal wall known as the G-spot, another release can happen. This is what people often call female ejaculation or squirting. Here's the part most people don't know. This fluid doesn't come from the vagina itself. It's released from tiny glands that sit around the urethra. Some researchers even call them the female prostate because they share certain features with the male prostate. When these glands are stimulated, they can release a fluid that's different from urine. Scientists who have studied it closely find that it contains traces of substances like glucose and specific proteins, along with some elements also found in urine. But the key takeaway is this: it is a natural expression of pleasure, not just waste being expelled. Think of it as the body's way of saying, I feel safe enough, open enough, and deeply connected enough to let go fully. Shifting the meaning now, here's where intimacy really comes alive. Because while the biology is fascinating, the real magic is in what it means. When a woman's body releases like this, it's often a sign that she feels deeply safe with you. It's not about performance. It's not about a goal to achieve. It's about the nervous system letting go, the heart opening, the body saying, I trust you enough to release everything. That is not something to fear. That is something to honor. Imagine two possible responses. Response 1. Pulling away, joking nervously, or rushing to clean up like it's an accident. Response 2. Staying present, smiling, holding her close, whispering something like, that was beautiful. Which do you think creates deeper intimacy? Which do you think she'll remember in her heart for years? It's those moments of acceptance, those small choices to respond with warmth instead of discomfort, that write new stories of trust in a relationship. Is it safe? Another common question I hear, is it safe? The short answer, yes. If both partners are healthy and there are no underlying infections, female ejaculation is safe and natural. There's no evidence that it poses any health risk. And no, you don't need to be afraid of it. You don't need to avoid closeness because of it. In fact, most of the health risks in intimacy don't come from this fluid at all. They come from things like untreated infections, which can be prevented through open conversation and regular checkups. So if you're in a committed relationship where you both communicate honestly about your health, you can relax. This is not something to worry about. Here's something beautiful I want you to take with you. When you respond to your partner's natural expressions of pleasure with care, presence, and acceptance, you're not only strengthening her trust, you're also supporting your own health as a man. Research shows that men who engage in emotionally connected intimacy where they're not performing but truly present often experience lower stress levels, better heart health, improved sexual function, greater emotional resilience. Why? Because your body can only relax and respond fully when your mind isn't caught up in pressure or performance. When you shift from, I have to do this right, to, I get to connect with her deeply, everything changes. Practical steps for men. Now let's turn this into something you can bring into your own relationship. Here are 5 gentle practices to help you create the kind of intimacy where deep release, whether that includes female ejaculation or not, can naturally unfold. 1. Create emotional safety first. Start by checking in with her. Ask how she's feeling. Let her know she's not just desired, she's cared for. 2. Slow down. Instead of rushing toward the goal of climax, explore her body like it's a landscape you've never walked before. Touch with intention. Breathe together. 3. Respond with kindness. If a release happens, stay present. Whisper something affirming. Smile. Let her know her body is welcome. 4. Remove the shame from cleanup. Keep a towel nearby. Bring her water. Hold her after. Make it about care, not about embarrassment. 5. Reconnect afterward. Ask how she felt. Share how you felt. Let the conversation be part of the intimacy itself. Embracing vulnerability. Now, I know some of you may still feel unsure. Maybe you've never seen this before. Maybe you worry you'll mess it up. Maybe you grew up in a world where these conversations never happened. Let me reassure you, there is no perfect script. There's only presence, patience, curiosity, kindness. Those 4 qualities will carry you further than any technique ever could, because what most women long for isn't perfection. It's to feel safe, seen, and cherished. When you offer that, you create intimacy that doesn't fade with age but deepens. So tonight, or the next time you're with your partner, I invite you to ask one simple, brave question. It could be, what kind of touch makes you feel safe? Is there anything new you'd like to try together? What makes you feel most connected to me? Listen to her answer. Don't fix, don't rush, just listen. Because when you do, you're not just learning about her body, you're learning about her heart. And that is what transforms intimacy from something physical into something life-giving. If this conversation opened your eyes or gave you something new to think about, I'd love to hear from you. Drop a comment below. What stood out most to you? Or what question do you still have? This is a safe space for curiosity. And if you found value here, please hit that like button, share this with a friend who might need encouragement, and subscribe so you don't miss our next talk. Remember, intimacy isn't about tricks or performance. It's about presence, kindness, and connection. And love, my friends, only grows richer with age when we nurture it with care. I'm Dr. Michelle Zion. Stay kind, stay curious, and keep choosing connection in your body, in your relationships, and in your heart. I'll see you next time.